tell Dr. Fielding I'm here?
He's trying to stabilize one of your patients, Sarah Dean.
Sarah Dean, what's wrong?
I think Dr. Fielding suspects meningitis.
I'll call him to.
His office is right there. I'll tell him you're here.
Dr. Lee to trauma. Dr. Lee to trauma.
You missed it, didn't you?
Meningitis isn't exactly what I first think of when a child comes in with a runny nose and a fever.
What about projectile vomiting? First-year med student would know enough to run tests on a child with these symptoms.
Your point?
My point. This is the third patient of yours I've treated this month.
Well, that's what you're here for, isn't it?
Not to treat emergencies you've created. Like the patient who went into shock because you didn't check to see if he was allergic to penicillin. Or the child we had to revive because of your incorrect dosage.
I am too tired to stand around here and listen to your lectures.
You know what they call you around the hospital?
I don't take a lot of faith in hospital gossip.
They call you Dr. Feelgood. Just what are you on, Jerry? Tranquilizers, sedatives, bennies? The residents tell me that you pay them to take your calls because you're too zonked at night to come back to the hospital.
Everybody else's life is everybody's business. Well, you hit the bottle pretty hard yourself.
Yes. And I gave up my practice and got help.
Well, good for you.
Oh, the pompous self-righteous. You're hiding, Jerry. You're using our profession to cover up drug abuse.
You can't talk to me like that. You'll be hearing from Marsden.
I'm sure I will.
Mr. and Mrs. Dean, as soon as we have the results back, we'll have more to tell you.
Well, you're a bit late if you're concerned, Doctor.
Why don't you let me prescribe something for you to help settle you down?
I don't need your pill.
You're very lucky to have Dr. Fielding on duty. He's a very competent man.
Yes, he is. We thought we had a competent man.
I'll look in on Sarah later.
I don't want you anywhere near my kid.
Doctor?
Tests confirmed that Sarah's got meningitis. Anyone we should call?
Perhaps someone could get in touch with my office and ask Dr. Peterson to take my calls.
I'm going to have to admit you, Jerry. Should we call your wife?
Carol left last Christmas.
I'm sorry.
My wife, my kids. These last few months have been downhill all the way.
You get back up? I know. From experience.
You make it sound simple.
When I woke up and emerged with the DTs, I realized I had to make some choices. It wasn't easy.
One time, being a doctor was the most important thing. I had time for everybody. Time to listen to my patients. Time to consider their treatment. But the mortgages grew bigger. And the kids needed private schools, and Carol kept pushing for bigger and better. And the more patients I saw, the more money I made.
So you get a little tired, you need to pick me up, you can't sleep, you take a little something to relax.
Antidepressants, tranquilizers, barbiturates,
booze, dope.
Drug companies claim to have a cure for everything, and I fell for the hype.
Well, what are you going to do about it?
I guess I'm going to have to find someplace to get some help.
That's what I want to hear.